Welcome to This Week in South Carolina. I'm Gavin Jackson. Opioid abuse continues to rise in our state, as does alcohol abuse. SCDAODAS Director Sara Goldsby joins us to talk about what her agency is doing to help with these addictions. But first, SCDHEC's Director of Public Health, Dr. Brannon Traxler, discusses the COVID-19 pandemic, monkeypox, and the West Nile virus outbreak. Dr. Traxler, welcome back to the show.
Thanks. Thank you for having me again.
So let's just start off by talking about what's the latest on the current COVID-19 pandemic in the state, Dr. Traxler, how things are going, the status of that outbreak, the pandemic, and of course, who should be getting these new boosters and when?
Sure. And so I am pleased to say that things do look like they're improving right now. We saw a second Omicron mini surge, is what I'll call it, really a bump. The later part of this summer that really has been occurring across the world with the subvariant BA.5 taking over. And I'm pleased to say that it looks like we are on our way out of that bump. We've had a couple of weeks where it wasn't a complete downward trend, but otherwise the last number of weeks have been going down in terms of cases. The also very good news with this was with this mini surge or bump, we did not see a correspondingly, high increase in hospitalizations or deaths. We saw a little bit of increase, but not significant, and certainly not to the extent we'd seen before. So that shows that this virus, as it mutates, thankfully, while it may get more contagious, is getting less severe. And then certainly having these bivalent boosters that target that BA.5 as one of the components of it is great, and it really is a game changer if enough people get vaccinated with it.
And these boosters, like you're saying, it's kind of targeted toward these variants too, and it's for pretty much the general population, people that weren't covered by previous boosters. Kind of just break it down maybe for folks who are interested or want to know more about these.
Sure, and so really it can be for people who have or have not had previous boosters, as long as they have had that primary series. And so it's got two components. That's one thing a lot of folks don't realize. We mentioned the word bivalent, which this is the first of the bivalent boosters. But that just really means that there's two parts to it. It combats two different things. And so it still has a component that is the same formulation as the original vaccine. So the same thing everybody's been getting. But then the other one targets BA.4 and BA.5. And so anybody who has finished their primary series, who is 12 and up for Pfizer or 18 and up for Moderna, is really encouraged to get it as long as they are 2 months out from their last shot. Mm-hmm. And the other piece is if you have had a COVID infection, you've tested positive, then we really do recommend you wait 3 months before you get this booster to get the maximum benefit from it.
Yeah, I had COVID in early August, so I'm guessing I'll just wait a couple more months, probably wait till things really get colder. We see those kind of, all those rates kind of tick up too. And when we talk about flu, we talk about all those different things that happen when the weather gets cold.
Absolutely. And so I would recommend, correct, I think that would put you right at early November being eligible for it. And that's when we start seeing the cold weather usually in South Carolina. And so I'd encourage you to get it then.
So Dr. Traxler, when we talk about that, we look back to last year when we had that horrible surge. That was the worst part of the whole COVID-19 pandemic to date for our state. I'm guessing you don't expect anything like that. Do you expect that this will just kind of become endemic almost like the flu and that we'll be getting these boosters and we'll be kind of combating any potential massive surges like we saw?
So I certainly hope that we do not see a surge like we saw last winter. And even though we saw the highest case counts really of the pandemic, I will say it was not the worst in terms of hospitalizations and deaths. Again, because it was the Omicron, it was the initial Omicron at that point. I do expect that there will be some increase in the winter, like we see with flu. But again, if this is endemic, we know it's going to be out amongst us. Our goal is to keep that increase down to a minimum, really to just see barely a blip, see like we do with flu, and really keep especially down the number of severe cases. Mm-hmm. And so I do think that this is going to become very similar to the flu. It may have different seasonality. We may see more of a summer and winter bumps. We just don't know yet. Depends on what the variants do. Mm-hmm. But I think the goal is also to continue then to get a yearly booster. I know that is certainly the federal government's plan and the scientists and everyone's hope.
Mm-hmm. And we'll be
Hopefully to combine it even with the flu one so that you don't have to get 2 shots.
Yeah, definitely. But an internal review of DHEC's handling of the COVID-19 pandemic was reviewed by the Post and Courier recently, and it found that DHEC was unprepared for the unique challenges of a novel pandemic, unable to communicate effectively with partner agencies and the public, and understaffed for sustained emergency response that ultimately lasted more than 780 days. Dr. Traxler, you've been Director of Public Health since April 2021. Tell us about what's being done to address these issues and if this is still a problem.
Sure. And so we are really looking both agency-wide. Dr. Simmer is doing it, and I can tell you that I'm doing it in public health at every aspect of this response. You are correct. That is our after-action review that we contracted with a consultant to do. And so based on that, the team is going through and creating basically an improvement plan, identifying these recommendations, of which there's over 100 in the report, identifying what of those need to be implemented, soonest versus can wait a little bit, and adding to them. Really having important, sometimes difficult, but very necessary discussions about what we can do to improve things so that we are more agile and flexible and ready to go the next time, though hopefully that won't be for many years.
Mm-hmm. And are you getting enough support now from the state? It feels like this was a kind of a big wake-up call for state budget writers. I mean, DHEC's now going to get a new $140 million lab. Obviously, that was a big linchpin point during the pandemic because all the testing was going through that state lab and, of course, contractors as well. But there was a bottlenecks in the beginning. So tell us about what kind of support you're getting from the state to fix some of these problems, too.
Certainly. And so we are getting more support, not only from state, not only from the budget writers, but really from everyone. We are getting more support from everyone out there in South Carolina. I think this has been a wake-up call for everyone that public health is critical. And a lot of people, I think, in South Carolina didn't even know what all DHEC did. A lot of our work we like to do in the background. We like people to not have it necessarily on their radar. And so we want to keep people healthy and safe with minimizing disruption, certainly to their lives. But this did wake them up, and they do realize now what all we do. And so really seeing support from everywhere has been really important, especially, I think, for morale of the team. Mm-hmm. Certainly then financial support has been critical and so beneficial. We are ecstatic about the $104 million for this new lab. I have a meeting this afternoon. We're looking at, proceeding right along with lab building plans and are looking at drawings and such. And so that is very exciting. Our lab team needs it, and it's really just very forward thinking. And so I'm very pleased that we were able to do this, that we got that support.
Mm-hmm. And of course, not just COVID-19, but a variety of different viruses and diseases, which we'll talk a little bit more about in a moment. But of course, there's also talk about splitting up DHEC. That's something that you're not dealing with directly. Of course, you're not the director of DHEC, but that's something that has been floated around the State House too. And of course, that bill didn't make it to the governor's desk this year, but we'll see what happens in the future legislative sessions. But Dr. Traxler, I want to pivot now to monkeypox, or mpox, as DHEC is calling it, to help destigmatize this. This started spreading around the world earlier this year, ramped up in the summertime, especially here in South Carolina. There's more than 22,000 confirmed cases nationwide, more than 130 here in South Carolina. How concerned should folks be about monkeypox?
So right now, the risk to the general public is low. However, I do encourage people to keep it on their radar. Our aim is to keep the rest of the general public and to every member of South Carolina, of our residents, low. Right now, we are seeing it especially in the subpopulations of men who have sex with men. And we're seeing some disparities even within it, seeing higher case counts among Blacks than we are whites. And so we're really trying to do a lot of education as well as targeting our vaccine campaign to those who are at highest risk. But the risk to the general population as a whole is still low at this point.
Mm-hmm. So what's DHEC doing now to reach out more? I know we got the emergency dosing recommendations from the federal government talking about stretching this very limited supply. I think you guys have given about more than 1,400 doses so far over the past 2 months. We're coming up on 2 months, I think. Has that been going slower than expected? And what are you guys doing to expand that outreach to maybe boost those numbers?
We are doing everything we can in terms of outreach to folks through all different avenues, and really our partners have been critical with that. And so we are work to get vaccine out into other providers' hands, particularly some of our Ryan White clinics and other FQHCs are two who have been great. And so we do have a vaccine locator map now, similar to the one we had for COVID. We have one for Mpox now on our website, so people can go there and see it's not just the health departments anymore that have it available.
Mm-hmm. And you guys have expanded the criteria for folks. From originally, it was like really if you had a close contact or something like that, to now basically the entire gay population of the state.
Sure. So right now it's all MSM, all men who have sex with men, but also all persons, regardless of gender, who are on pre-exposure prophylaxis, what we call PrEP, for HIV.
Gotcha. And then really quick, Dr. Traxler, another outbreak that we're seeing in the state, specifically here in Richland County, is the West Nile virus. There's been one death so far, a couple cases. Tell us what people need to know about this, the status of this outbreak, and what they should be looking for to prevent getting this virus.
Certainly. So as of a couple of days ago, the latest data I have, we had 11 cases in the state in 2022. And correct, 6 of those were in Richland County, 9 of them were in the Midlands region, and that includes that unfortunate one death. West Nile virus is something that we see some every summer, but we are seeing an increased activity in Richland County in terms of surveillance among mosquitoes, as well as in birds and humans. And so what we're encouraging people to do is get rid of your standing water. Standing water outside your home it is a breeding ground for mosquitoes. They love it. So get rid of any, even just buckets that you might have laying around that collect rainwater. Any standing water, wear bug spray, wear insect repellent when you're going outside. Make sure that you're not letting mosquitoes into the house. Make sure your windows and doors are tightly fitting.
And it's also pretty rare too, so people shouldn't be too concerned, but just take some precautions because of this outbreak.
Correct. The majority of people who get infected will not have any symptoms, and then about a fifth of them will have fever, body aches, feel poorly, and less than 1% will have very severe, where it does affect their brain or nervous system. But
Gotcha.
As we have seen with this very unfortunate, one death here in this summer in South Carolina and the Midlands, it can happen to people. And so we really want them, it's easy precautions to take. We really would like them to do it for their health.
Gotcha. Some important information there from Dr. Brannon Traxler. She's DHEC's Director of Public Health. Thank you so much for joining us.
Thank you. Have a good day.
Thanks. Joining me now to discuss drug and substance abuse issues in the state is Sara Goldsby. She's the Director of the Department of Alcohol and Other Drug Abuse Services. Sara, welcome back.
Thanks, Gavin. It's great to be here.
So, Sara, we have a lot of new information to talk about since we've last spoken, but I want to get you to just kind of paint us a picture, give us a refresh on the current state of overdoses and opioid overdose deaths in our state. What's that look like? I know we've had a bunch of increases, unfortunately. What's the latest data say?
Yeah, so we're still leaning on the 2020 drug overdose death data, eagerly awaiting, anticipating the 2021 overdose death data as it gets finalized by DHEC and the CDC. What we saw in 2020 was just a dramatic increase nationwide, really, and that includes our state. What we saw was about a 52% increase in drug overdoses for the state between 2019 and 2020. Unfortunately, we had anticipated some of that, because we knew that, the isolation and the conditions of the pandemic would lead to more drug use. But I think what we recognize now is that simultaneously the black market for drugs, the illicit drug market in the United States and in our state too, shifted dramatically in that year from 2019 to 2020 in ways that we couldn't have anticipated. With the introduction of fentanyl, very potent fentanyl in the opioid products that were coming into the United States, but also in non-opioid products, including, stimulants, the cocaine and the methamphetamine that we see now. Almost all of it is laced with fentanyl, the drug that's causing most of the overdoses.
And yeah, I think it's some 4,000 South Carolinians have died over the past 3 years. Is that about right?
Yeah, that sounds about right. I think we're looking around 1,500 to 1,700 a year. Just, folks in our neighborhoods, people we know, and the demographics even shifting slightly as we monitor this week to week with our partners on the opioid emergency response team. We're noticing shifts in the African American communities in South Carolina now, climbing with overdose incidents, where other states had seen this before. So we're monitoring that closely and trying to get the word out to particular demographics and populations, because what we think and expect is that certain drug markets, like I said, are being really, infiltrated by this deadly fentanyl.
Mm-hmm. And Sarah, before we move on to the latest news that you guys have about combating this problem, can you tell us about, do you think that those trends are holding steady? Are they plateauing at all for 2021? When you look at anecdotal data, I know it's not finalized yet, but 2021, 2022, can you speak to any of that?
I think, with the preliminary data available from the CDC, we will see an increase again from 2020 to 2021 in overall drug overdose mortality. What we're monitoring week to week is incidents of suspected overdose and the first responders' response to those incidents. And I hate to be too optimistic too early, but I do notice that we are starting to level off in those incidents. And so I remain hopeful, and we expect and hope that it's just due to a lot of hard work between our public safety partners, the law enforcement doing incredible interdiction work on the traffickers and the supply, but a lot of hard work by all of our community partners around the state, awareness raising, prevention work, and then, of course, having the overdose antidote naloxone available, getting more people into treatment. All of these things combined, we think we're hopeful that we're seeing the trends level off week to week now.
And Sarah, your agency has a pretty broad mandate when it comes to dealing with a lot of these issues that folks deal with, unfortunately. Can you tell us, we hear about opioids, and those unfortunately get a lot of the headlines, and because it is just such a massive issue, but what about other substance abuse issues that your agency is dealing with and combating?
Yeah, well, Gavin, I know we've talked since, the start of the pandemic, but I think even before isolation measures went in place, we were worried that when they did, folks would turn to alcohol and drugs to cope with, the things that we were experiencing at the time. And some national surveys that occurred in, the spring of 2020 showed us that people were experiencing worry and sadness and fear and loneliness. Those things are all, experiences that cause people, that trigger people to cope with substances like alcohol and drugs. So we were very worried at the time about alcohol in particular, and monitored, social media, which I think we've talked about before. We saw a lot of social media memes supporting more alcohol use and alcohol use at earlier hours during the pandemic as a means to cope with this isolation, stress of working from home and homeschooling. So I don't know that we can honestly say we've seen the impact of what may have shifted during the pandemic in terms of folks needing treatment, seeking treatment, but we know that there's been an overall rise in drinking in the citizens in our state. Another indicator of this is with an analysis of the South Carolina alcohol liquor tax revenue, which shows significant increases in tax revenue from alcohol sales in our state over these past couple years. And it's just one more indication that the amount of South Carolinians are drinking has risen significantly. And so just, this warrants our attention. And I think, our messaging has been to take a pause, consider, your own personal relationship with alcohol, and putting things on our website like the alcohol use self-test, 10 questions that anyone can just ask themselves to really see if their drinking poses a risk to dependency and addiction. Yeah. So another main thing that we're worried about.
For sure. Yeah, that's definitely a good self-check right there, and red flags that you're seeing in terms of consumption rates and abuse, unfortunately, as a result of the pandemic. So many things we've seen come out of the pandemic. But one of those that we're just talking about opioids, of course, and one of the big settlements we saw was, $26 billion. It was a big settlement with 3 of the nation's top pharmaceutical wholesalers, as well as Johnson & Johnson. That's a nationwide settlement. South Carolina is getting about $360 million over the next 18 years. Tell us where this money is going to go, this $360 million over the next 18 years, Sarah, and how we're going to hopefully fix some of these problems.
Yeah, well, first, Gavin, we really have to thank our community leadership and the leadership of the South Carolina Attorney General, who spearheaded this litigation on behalf of the state. And, is really, going to see the reward of, the communities being represented in that litigation, getting the funds and the resources and the relief that they need to address the epidemic head on. That litigation has led to, like you said, the settlement. And the South Carolina Opioid Settlement Allocation Agreement, which folks can find online at the National Opioid Settlement website, really outlines how that money is going to be spent with, the Guaranteed Political Subdivision Fund and the proportions of that money that will go directly to the municipalities and the counties around our state who participated in the litigation. And then, in the spring, the General Assembly created the South Carolina Opioid Recovery Fund Board with 9 appointed members. And this was possible with the South Carolina Opioid Recovery Act. Those 9 members will really administer and disperse the South Carolina Opioid Recovery Fund in accordance with the terms of that settlement agreement to make other funds widely available for discretionary grant applications.
Mm-hmm. Do we have any idea about what these grants might be looking like? Any idea what might be rolling out soon?
As far as I know, the board has met in July. They'll be meeting again soon. And I think we all anticipate directions and a way to apply for those funds and information about how the political subdivisions will be getting that money in the coming weeks.
Mm-hmm. And really just to get that money out to these localities, these smaller places, to really just try and get some best practices there to help fight this crisis.
Yeah, absolutely. And, the settlement really outlines what the agreement refers to as approved uses and core strategies. And so the money can really only be used for those evidence-based practices or what clinical expertise and systematic research have evidenced to, support outcomes. Mm-hmm. And I think it's important and really a highlight of this broad sweeping national litigation, because we've seen with settlements in the past, funds coming back to the state that have wide opportunity for multiple uses that don't necessarily go to remediation or abatement of the problem. And so we were excited in June, we partnered with the South Carolina Institute of Medicine and Public Health and pulled together some subject matter experts from the universities in our state, Clemson, DHEC, University of South Carolina, MUSC, to really contribute more content to the list of those core strategies and approved uses in hopes that the decision makers at the local level will find this as a resource, really outlining the strategies, but with richer context and a connection to the national guidance that we have. The message being, with all of this, we know what works. Mm-hmm. There's no need to invent anything new to address the opioid crisis. It's really just about scaling the best practices and spreading the best practices.
And Sarah, how does this money, $360 million, correct? Was that what we're talking about? $360 million over 18 years. I guess that's about $2 million a year. About how can you make that? How does that supplement what's already been put in the state budget? Are you guys getting more money from state lawmakers, even as we see these opioid deaths skyrocket?
So the majority, I think, of the relief so far to the state to address the opioid crisis has come from Congress and federal appropriations, as Congress has made, really states a priority and a leader in addressing the crisis. So we've had several packages appropriated and authorized by Congress that have come to the state by way of the state targeted response grant and the state opioid response grant. And so we're in the third wave of those, and those have, averaged, between $16 and $23 million a year in 2-year, grants. The importance of that can't be understated because it's really built the infrastructure for the programs and services that we currently have to address prevention, intervention, treatment, and recovery. The Department of Health and Environmental Control has also been awarded funds by the CDC to address certain aspects of the crisis. And when we tie all these things together, we've really done a lot of groundwork in the state to address the crisis. The money that will come from the settlement funds can build on that. And I think if we align all of these strategies and fill the gaps geographically in our state where we know we need that scalability and the spread of best practices, this money will go a long way to shore up services and do prevention work for a number of years.
Yeah, not $2 million a year, $20 million a year, so a substantial amount there going out throughout the state. But really quick, Sara, I know there's a lot more to talk about, but we got to wrap up. Just tell me how folks can get resources if they are going through crisis, if they're in recovery, how people can get educated to know some of the warning signs or just to deal with opioids in general in the state.
Yeah, the best website for opioids information is still the justplainkillers.com website. We have new information on there now about the risks and dangers of fentanyl, and also all of the places in the state where naloxone, the opioid overdose antidote, is available, where treatment and recovery services are available. For anyone looking for, recovery or treatment support or information on any other substance use, we've got a couple sites. Of course, the embracerecoverysc.com website really talks about the nearly 500,000 South Carolinians in recovery, more and more every day, and where mutual support and treatment can be found around the state. And then the DHEC.sc.gov website, of course, the alcohol use self-test that we talked about there, and all the resources that we have.
Great. Well, thank you so much. That's Sara Goldsby. She's the director at DHEC. Thanks, Sara.
Thank you, Gavin.
For South Carolina ETV, I'm Gavin Jackson. Be well, South Carolina.